Good evening, my friends. Today I'm gonna show you how to carve a maxillary second premolar tooth from the white salt block. As always, here are the dimensions of the tooth. The crown length is 7.7 millimeters. When we multiply this dimension with 3, it's 22.8 millimeters, and the crown length is 14 millimeters, and 3 times bigger is 42 millimeters. This is the mesiodistal dimension. The mesiodistal dimension is 6.6 millimeters on average, and when we multiply with 3, it's almost 20. It's all 19.8 millimeters, and the buccolingual dimension is in average 9 millimeters, and when we multiply with 3, it is 27 millimeters in total buccolingual dimension. Here is the salt block with the proper dimensions. This will be the crown length, and this will be the root, and mesiodistal dimension and buccolingual dimension will be here. So first we start with the cervical line, as always. This is the cervical line curve. Please remember, from anterior teeth to posterior, the cervical line curve becomes more flat. I'm carving now the buccal surface. The contour crest, buccal contour crest, is located here in this area. It's not far away from the cervical line. And buccal surface curve. This tooth is not much, the buccal surface inclination is not much as the maxillary first premolar. We have a buccal ridge here, but buccal ridge is not so prominent, just like the canine or first maxillary first premolar. The buccal ridge is more prominent with the canine and maxillary first. We have a buccal ridge on this tooth as well, but not too bulky. And mesial and distal slopes of the cusp, buccal cusp. Please remember, the maxillary first premolar had a unique property. The mesial slope was longer than the distal slope, but for the maxillary second premolar it is different. Just like the teeth before maxillary premolar, the distal slope of the buccal cusp is longer than the mesial slope. So I have decided that this part will be the distal side, and so the distal slope will be longer than the mesial slope. And this tooth is a rounded tooth when compared with the first maxillary first premolar. Not too sharp cusp tips, and all the angles are more rounded compared with the first maxillary first premolar. And this tooth is more specialized for chewing function. Maxillary first premolar is more supporting the canine function, tearing apart, but The second premolar is more specialized for chewing, and it primarily supports the function of first molar. So the cusp tip is more rounded for chewing function. Okay. And the approximal areas. Cervical line, and at the approximal surfaces it is a little bit curvy, but please remember that for the posterior teeth the cervical line becomes more flat in the approximal areas. Cervical line curvature becomes more flat, not that much curvy like the anterior teeth. And lingual surface. Yes. The contracrest in the lingual surface is located a little bit occlusally than the buccal surface. The buccal surface contracrest should be located here, close to the cervical line, but at the lingual surface the contracrest will be located more occlusally, a little bit more far from the cervical line at the lingual side. And there was a buccal ridge here. It was not much prominent, but still we have a buccal ridge here in the buccal surface, but the lingual surface is more rounded. And please remember that the occlusal surface is wider buccolingually than the maxillary first premolar because of the chewing function of this tooth. So the inclination of the buccal and lingual surfaces are not as much as the maxillary first premolar. The cusp tips are more far away than maxillary first premolar, so the inclinations in the lingual and buccal surfaces are not that much. The inclinations are less than the maxillary first premolar, so please be careful. Don't make the cusp tips too close to each other. For the maxillary first premolar, please remember the cusp tips were rather close and the occlusal table was narrower than the maxillary second premolar. And from the occlusal surface, the maxillary first premolar was has an hexagon shape, but we can say that this tooth is more rounded, more oval or elliptic shape from the occlusal view. So the corners are not that sharp as the maxillary first premolar. So I am making these corners more round, you see, not sharp corners. So the contours of the crown is roughly done now. You see more oval occlusal surface, and the cervical line is almost done. The crown of maxillary second is premolar is shorter than the maxillary first premolar, but the root is a little bit longer, we can say. And here you can see this was the distal side. The contour crest at the distal side is located almost at the middle of the crown length, so I will carry the contour crest to a little bit cervically to here. And this move makes the distal slope of the cusp a little bit longer, as you can see here. Yeah. Okay. We have a single root with this tooth, just like the mandibular premolars. The root is a wide root buccolingually, and the apical third of the root is tilted to distal side. I am using the same pack of soap from the beginning of this year, so my soap is becoming more and more dry. Please don't do that. Please, you better use a softer soap block. I am now tilting the apical third of the root to distal side. The root has a blunt apex, not pointy, not sharp, a rounded apex. Yes, the root is almost done now. We have depressions on root surfaces. The distal depression, the depression on the distal side is a little bit deeper than the depression on the mesial side. Okay. Okay. So, the outline of the crown and root is roughly done. I will now refine my cervical line. Yes, the cervical line is better now, and the cervical line transition, the root crown and root junction carving. You all know this is a fine carving here. You have to be careful about the transition area. You have to be very careful about crown to root junction. Okay. Yes. So, the crown and the root. And finally, it's time for the occlusal surface carving. We have two cusps here, and the cusps are at equal height. So the mesial and the buccal and lingual cusps are at the same length. They are both functional, and they are almost at equal size. Sometimes the lingual cusp is a little bit shorter than the buccal cusp, but usually they are at the same length. So we are dividing the buccolingual dimension in two halves for the lingual and buccal cusp, and we are now deepening the central groove. This tooth has a short central groove, because the marginal roots are bigger and stronger than the maxillary first premolar. The triangular fossas are closer to each other than the maxillary first as well. So two strong cusps, a short central groove, and two strong marginal roots are the typical properties for maxillary second premolar, and the cusps are far from each other when compared to maxillary first premolar. And typically these tooth have more supplementary and accessory grooves than maxillary first. There is not any grooves that extends beyond the marginal roots. There was a groove in the mesial side of the maxillary first premolar, please remember that. But for the second premolar, there is not such a groove. The marginal roots are intact. So you can see the distance between the cusp tips are more open than the maxillary first. And the occlusal surface is more rounded, more elliptical, an oval shape than the maxillary first. As we said before, more supplemental grooves are present. And the surface, occlusal surface, seems like more wrinkled. You see? I'm not sure as you can see, but I think you can see if you see it from here. Yes. More supplemental grooves, yep. Here you are, guys. So this is roughly the shape of maxillary second, premolar. Just to repeat, the crown is shorter than the maxillary first, but the root is a little bit longer than the maxillary first. The crown contours are more rounded than the first premolar, and these two cusps are almost at the same length. They are both functional. The buccal ridge is not as prominent as the first premolar, and the second, the lingual cusp is also has a rounded tip. The slopes of the cusp tips, the distal slope is longer than the mesial slope. It was opposite at the first premolar, please remember. And the occlusal surface is more rounded, more oval shape than the first premolar. It was more angular and hexagonal shape with the first maxillary first, please remember. And the cusp tips are more open, and the occlusal surface is wider buccolingually than the maxillary first, because this tooth is primarily designed for chewing function, and the central groove is shorter, and there is much more supplemental grooves than the first premolar. The mesial and distal marginal ridges are bigger and stronger. And we have depressions on the root surface on the distal side. The depression is a little bit deeper here. These depressions provide anchorage to the root inside the bone, as you know. This is the depression on the distal side, and more shallow depression can be found in the mesial side. And lastly, you have to polish it very well, you know. Yes. So guys, thank you for watching. And I have to stop myself now, I guess. So that's it. Maxillary second premolar. Take care, take it easy, and see you later. Bye bye.